right, we should be live. Welcome to our second of our weekly Coos Health and Wellness town halls for COVID-19. We have Florence Portal-Stevens, our not behavioral health, that wouldn't make sense, would it? Our public health director, and Brian Leon, who's our epidemiologist, to go over some of the most up-to-date information on COVID-19 in our area and answer some questions. If you have questions, you can submit them in the comments section of this live feed, or you can submit them to our email address, which is covid19.questions@chw.coos.or.us. So I'm going to hand it over to Florence, who will give us an update.
Thank you, Eric. Good evening, everybody. Thank you so much for joining us. We're going to go through those slides and take your questions in a bit. All right, so we thought we'll do a quick COVID-19 101. So yes, the virus transmits person to person and via the droplets that one might sneeze or cough into the air. The symptoms are flu-like symptoms that may include a fever, sore throat, dry cough, shortness of breath, muscle pain, and fatigue. You have to remember that fever may not be present in the very young, very old, or folks who are immunosuppressed, and those are people who have cancer, lupus, or an autoimmune condition. And also, of course, fever may not appear in people who are taking over-the-counter medication to reduce fever. Most at risk are the elderly and the immunocompromised individuals. We'll talk about this a little bit later. Incubation period, meaning the time it takes for this virus to express itself in your body, ranges between 2 to 14 days with an average of 5 days after exposure. So quick update on what's happening in Oregon. We were realizing that in a week we've had 4 times more cases than we had last week, and we're now at 65 positive cases that we know of in Oregon. Cases are throughout the state at this point. We still do not have a positive case in Coos County that we know of. I just wanted also to let you know that we now have a daily update that you can sign up for on our website. You just have to provide your email address, and we will provide you with the latest data that we are aware of. So the public health state lab and private labs can now test. However, there seems to be a little bit of a shortage in the sample kits. And so what we also wanted to let you know of is that we are aware of short supplies of personal protective equipment, and we received the Oregon stockpile order that we made. And at this point, the state of Oregon is asking the federal government for national stockpile. So who is the most at risk for coronavirus? So we know that about 80% of people who become infected will experience mild flu-like symptoms. The most at risk are adults 60 years old and older, people who are immunocompromised, people who are experiencing chronic conditions such as heart, lung, and/or kidney diseases, And we also know that older adults are twice as likely to experience severe symptoms of the disease and might need hospitalization. Okay, so I know we've heard about this over and over, but it's very, very important to take all of those steps to ensure that we are limiting the spread of COVID-19 in Oregon and in our community. So first, stay at home as much as possible. And this is kind of the reason why the governor is taking those drastic social distancing measures and to really help slow down the spread of this virus. It is important that you avoid close contact with people who are sick, that you wash your hands often with soap and water for 20 seconds. And if you do not have soap and water available, please use a hand sanitizer, alcohol-based, with at least 60% of alcohol in it. Avoid touching your eyes, nose, and mouth with unwashed hands. Clean and disinfect surfaces that are often touched. Cover your cough and sneezes. And take care of yourself overall. I know this is a stressful time, but I think trying to keep healthy, eat well, and try to exercise will help your body be resilient to this disease. So, an important thing to remember as well is when to seek treatment. So a few pointers here. One, there is no treatment for COVID-19. Two, there is no vaccine for COVID-19. So the recommendation is that if you are experiencing mild symptoms, please stay home. If you want to seek guidance from a healthcare provider, you can call your provider and follow their guidance. They're likely going to tell you to stay home, possibly self-isolate, and take care of yourself. Plenty of rest, drink some fluids, and possibly reduce the fever with over-the-counter medication. Please do not go to the emergency room unless you have a medical emergency. And the reason for this is that we need to make sure that our emergency rooms are free of mild symptomatic patients, and that we can take care of the folks who really need the services of those specialized units. Okay, so what can you do to prepare? So the first thing is try to remain calm. And I know this is hard to possibly consider, but this is going to be lasting a while. If you can, have a stock of non-perishable food items and also prescription medication and cleaning supplies. As we talked about last week, please refrain from purchasing medical grade personal protective equipment, because our healthcare provider and first responders really need those. And also, stay current with the latest updates and recommendations from the public health system. There is a lot of misinformation going on, a lot of rumors. If you want to be as updated as possible, go to the Cuse Health and Wellness website and you will have the latest numbers that we know of. Okay, so in terms of community preparedness, we've been busy. We're going to keep on being busy. I just wanted to let you know of the big kind of like main points of operation at this point from the public health division. So of course, one of our main roles with communicable disease is to do what's called contact tracing and investigation. And so this is when we call someone who has a positive test result and ask for close contact, possible exposures, so that we can try to mitigate the spread of the disease. What we've been doing also is that we have 2 public health nurses who have been reaching out to long-term care facilities, to daycare providers, and a lot of medical practices, especially the smaller ones, to answer the question and provide tips and guidance around infection control and prevention. Just so you know, we are also working on developing what's called the Casper survey, which is gonna help us identify the needs of our population throughout the county. And so, of course, we'll publish that when we are ready to go out. But that means that you may have some public health staff and volunteers knocking on the door and asking you to answer a few questions. We are putting together a special task force to outreach to our most vulnerable, elderly, people in poverty, and our homeless population. And of course, the latest info will be on our website. And as I mentioned earlier, we have this daily update that you can sign up for. All right, try to go fast. Please shoot out your questions.
Okay, well, we have some that have been coming in. We had one that came in earlier today from Heather that said, how many tests have been completed and who can get tested and where?
Good question. So far, there have been 42 tests that have been done. And again, like Florence was mentioning, there is going to be a now daily update about the number of tests that we've received, the number of negative tests results that we've received, which so far of all the results, again, we have no positive cases. So every one of the ones that we've already received are negative. If there are also just a number on the number of pending results. So we are being notified by the medical community of tests that are being performed or ordered. And so we do have a pretty decent idea of how many we just haven't heard about yet. The testing criteria has opened up a little bit, especially now that private labs, commercial labs are able to take orders. Again, though, while that has opened things up a little bit, there has been a shortage of sample kits for us to take swabs. And by us, I mean the community, the medical community. So we are hoping that supplies will start ramping up and that your healthcare providers and medical community will be able to open testing up even more. So right now it's really based on a clinical decision, a mix of, you know, what your medical history is, what kind of risk category you fall in, and how ill you are. We're really just trying to prioritize in that way.
And to confirm, clarify, we have no presumptive positive cases in our area.
Correct. No positive cases in Coos County as of today.
Sherry asked a question. She asked, do you suggest voluntary self-quarantine if you are over 60 plus?
I would say, thank you for this question. You know, I think I would say yes. At this point, you know, you want to protect yourself as much as possible. So I think really the guidance from the governor is going in that direction. And we're also learning from, you know, what's happening in Europe. And as I sound, I also am French, and my folks are currently, they're older than 60 years old, and they are being asked to stay at home as much as possible, and to, go out only to go get food and things like that. So I think this is a very good idea. There is even a suggestion in the order to avoid even family gathering at this point if you don't feel like it.
Well, I know that, and this isn't a question that's been posed at this point, but the governor said 25 people or less at a gathering, and the federal government says 10 or less. What would you lean towards?
I think, at this point, it's going to be like up to folks to make that decision.
Yeah, I think that makes sense. Mark had a question that I find quite intriguing. He asks if we can provide hand sanitizer or request stores to limit the purchase number for individuals coming in and trying to buy stores out of everything.
I think this is a very interesting question, and thank you for raising that, because we had not thought about talking to stores, but I think it's a valid request. So I'll definitely make sure that it's on the agenda for our incident management team meeting tomorrow morning. And as per us being able to supply, unfortunately, we are unable at this time to supply sanitizer for the public. We have some supply for our staff, and so yeah.
I think it's worth noting that it's just as difficult for us to get these supplies
Yes.
as it is for the general public to get the supplies.
Exactly. Like, we were very hopeful that an order we placed last week, we were like, oh, this order is not being canceled. This is great. And then a week later, we received a cancel. So we can't at this point.
Mark is on a roll with the questions.
That's great.
He's got some great ones. Thank you, Mark, for being this engaged. It's wonderful. So, can abandoned buildings be repurposed for quarantine for infected patients? Any way to social distance homeless populations?
But that's a good question, Mark. So as I mentioned in the presentation, we are working specifically to plan and outreach to the homeless population. Definitely, the idea is if someone gets infected with COVID-19 in this vulnerable population, and that we request that they self-isolate, it's going to be very difficult for them to do that. So the task force is really going to start looking at where, how, who, like all those questions. And so the first meeting is tomorrow, so I'm kind of looking forward to this. I've heard that there are quite a few buildings that are possibly available in the community. So thank you for letting us know of the abandoned building. And then in terms of, just to continue on the homeless folks, some of them do not have access to, regular water and sanitation, and so it's going to be very important for us to also make sure that we provide information and education and possibly resources so that they can take care of themselves and protect themselves.
Well, Mark also followed up with another homeless question about how they would get food and housing, but more, I think another good part of the question is, what can we do as a community to help out with these things?
This is great. Thank you very much, Mark.
That means
So how about, so if you want to join us at that meeting, you're welcome to come in or call in. and we can take your contact information if you're interested. But I would say what I can do is make sure that next week when we do that town hall, I provide information and update as to what the task force is working on.
I think that would be a really great update for a lot of the community that is listening here. I know Ashley had a question. What are our local governments doing to help with COVID-19 response?
Well, thank you, Ashley. So as of today, the county commissioners declared a state of emergency for the county. And this is going to be really helpful to the public health response in the sense that we're going to be able to activate the community emergency response team and get volunteers and hopefully get some support through the emergency management office at the county level. Regarding the task force that I mentioned about the homeless population, cities and other entities have been invited to that meeting as well. And we're anticipating that they're going to be great partners and collaborators.
And to add to that, Florence mentioned the CASPER survey earlier. That stands for Community Assessment and Public Health Emergency Response, and that basically is a survey that's for decades now has been used to try to assess a community's preparedness to be able to go perhaps a little bit of time without food and things of that nature. So we're really happy that some volunteers are now available to us through their emergency declaration, and that is going to be a huge help in getting that survey out there, because of course we are absolutely concerned about our homeless population, but we are also concerned about the entire community. And there are folks that are living paycheck to paycheck, or maybe they can't afford to have a stockpile of non-perishable food. So this is really an opportunity for us as a community to really come together and take care of each other. And I believe there are a lot of people that are looking forward to making those contributions.
Before I ask the next question, I just want to remind everybody that you can submit questions to the email address on the screen, or you can submit questions in the comment sections. Also, if you go to our website and go to the COVID-19 page, you can sign up for our situational status reports that go out nightly that have the most up-to-date numbers as far as positive cases, tests done, negative cases, all of the information that Florence and Brian talk about and update on an evening basis. Dominica had a question, and this is kind of a long question, but she says, "Hi, I'm just wondering if there will be anytime soon something like drive-through stations anywhere in Oregon for testing people for coronavirus like in Colorado. Not just couple of selected people like now. This way, more people would know if they're actually infected and spreading it between people. I noticed people think they just have a cold and still go outside. They don't do any self-quarantine. Also, people think that just people with symptoms are spreading it. We're actually people without any symptoms during the first 5 days spreading it most. We need to take more action in Oregon, please. I have family in Europe. We're so far behind them with testing." Thoughts on that?
Well, we could answer at so many levels. I'm gonna let Brian start on the answer, and I'll pick it up from there.
So some type of drive-through testing or mass testing potential is certainly something that we're attempting to prepare for. We're working with the medical community in getting ready for that. It is largely going to be driven by the availability of specimen kits and the availability of the laboratory testing capacity that is around. I'm afraid I'm not extremely familiar with Colorado's situation as far as what type of criteria they're using to test and where they have gotten a hold of what sounds like would be a pretty decent supply of testing specimen kits. But I can tell you that's something we're certainly looking forward to. We are certainly advocates of expanding our testing capacity. We want to see that happen. You know, we hear that the community is frustrated about the level of testing capacity up to this date, and we're behind you. We're totally with you. We want to see expanded testing, and we want, you know, people to be a little bit more confident in what their health status is when they have those concerns. I would say, as far as what we're asking to do generally with social distancing, you know, obviously a lot of the orders by our governor have centered around social distancing and trying to limit the potential spread of illness. So I think whether someone is demonstrating symptoms, whether someone is asymptomatic, whether someone is seriously ill, these are categories that the general admonitions for social distancing should be addressing if we can get everybody on board and contributing to that cause.
Yeah, so there are a few things that I want to add to this. So one, to your point about Europe, we're about, from what we know of, about 2 weeks behind in terms of what's likely to happen. Those measures that the governor took are hopefully going to help, and I'm really hoping that people are going to understand that they need to follow this as much as possible, and here are a few reasons why. One, we're learning that possibly our youngsters are carrier of this virus without symptoms or with really, really mild symptoms and can be spreading it around. So that's one. Second, we know that this is a very communicable disease. It spreads super easily and it stays on surfaces, and the more we are in contact with one another, the more it's going to spread. And what Italy, for example, is experiencing at this time is horrid, in the sense that they're completely quarantined as a country. Their healthcare system is absolutely overwhelmed. They have to choose between who they're gonna have to let go in terms of not having enough ventilators and that type of things. So this is something that we want to avoid, and this is why those measures, you know, are being taken. So I'm with you, Dominique. For sure, people, please be mindful. It doesn't mean that because you do not have symptoms or you just have this mild cough that you do not have COVID-19. And at this point, because we do not have enough tests, we cannot know what's up. We do not have a clear picture of what's going on, and hopefully the tests are gonna coming our way, and we're gonna know more.
Sherry has another question. Do you think that we need to reiterate that those individuals that are under 60 can get the virus? She is concerned that they have a false sense of security and they're not as serious about the situation as a whole.
Yeah, no, that's a great point. There are a number really of reasons why you know, some folks will consider themselves not at risk and therefore not take quite as seriously some of the precautions that we are advocating for. Age being one, perhaps something they may have heard in the media, or you know, someone that has a little bit more of a platform discussing, but absolutely there are people in their 40s being hospitalized elsewhere in the world. There are people even younger sometimes, and so yes, people under 60 that are relatively healthy, that do not have any immune system concerns, it is still possible that they can get the virus and can, have some fairly, serious complications from that infection. We are, of course, focused on our high risk group, but that is a matter of percentages. That is not trying to indicate that folks that are younger and healthier can't get this infection and suffer from it.
And I'm just going to add to that by saying that you may or may not know that our community is not a very healthy community. We're an older community. And we have a lot of people with, chronic conditions, and we know that those folks are likely to be more at risk for a severe symptoms and possible hospitalization. So I think it's really important that even if you don't think you can have this as an individual, that we develop that community mindset, right? That it is so important that we care about our neighbor in that situation, and that we not be selfish.
All right. Mike sent a question asking, what is the process if I want to volunteer to help public health with this?
Excellent question, Mike. So what I mentioned earlier is that we have been set up as an emergency operations center, and that gives us quite a few things we can do. Anyways, we now have Angela, who is our volunteer coordinator, and her email is angela.mayfield, MAYFIELD, at chw.coos.or.us. There is no spaces between all those letters and dots and stuff.
I've also added it to the comment section of our live feed in case you want to copy and paste it.
That's great. So pretty much what you would want to do, Mike, is email Angela, and we're keeping a list now of folks who are available to help. So thank you very much. If you could give Angela maybe your availability, contact details, and then we are in the midst of planning. We're going to definitely need a lot of people to go out and do this Casper survey that Brian was talking about. We're thinking about possibly 40 people at least. So we will reach back out to you, and thank you very much for offering your time.
We will also post a infographic in the next day or so on our social media pages to give you more access to that volunteer information. Sterling has a question around eating takeout from our local eateries. He's concerned that no one is talking about the risk or risks of getting food from takeout from businesses that we don't know for sure that are keeping things sanitized.
Well, I would say, Sterling, thank you for this question. So part of what we do in public health is that we inspect our restaurants, among other facilities, to make sure that they are actually taking the precautions they need to provide us with safe food. And so I would say in those difficult times, support local businesses, and please order takeout from those places, because I think we do not want to add to the difficulty of those times by not supporting our community, right? So I would say feel confident that our team of environmental health specialists have been working really, really hard for many years with all of our restaurants, and that they are implementing best practices when it comes to serving you with safe food.
All right, perfect. Hopefully that answers Sterling's question. He did ask about what our environmental health was going to be doing during this process, and I would imagine they're going to be maintaining the same high level of quality inspections that they do any other time. So if you guys have any questions, please feel free, send us some more via the email address or via Facebook. Do you want to speak at all about the governor's recent statement about extending the break from schools?
Yeah, so we can do that. We received this order actually less than an hour ago about the extension of school closure throughout the state of Oregon to a total of 6 weeks. And so far, so it's going to be closed until April 28th. We, I believe, posted this order on our website so people can look into it. We also posted the location because I know a lot of people in our community are really, how do we say that? They are supported by the school system in terms of access to foods for their children and breakfast and lunches. And so I know that the schools have been so awesome to keep some of the services going and posted the information on their website. We also posted that information on our website. I know it's difficult and I feel for everybody. But this is, like we discussed earlier, you know, those kiddos, they carry coronaviruses usually, you know, during winter times quite a bit. And so they will be definitely spreading this around. So keeping them home is the safest thing to do.
Absolutely. It's definitely difficult. I know as a parent, your kids in school, I know you say, well, we've got another 6 weeks of spring break. What does that mean for them on the other end? But it's great that the schools, I know that North Bend sent out a message today. They said they served 100 meals today between breakfast and lunch. Bella asks, are hotels exempt from the over 25 people per gathering?
Well, I'm unaware of an hotel that has a room that can host 25 people.
Because they have separate rooms, then
Right.
it's their social distancing is via sheetrock at that point, right?
Right.
Savannah asked, do you anticipate stores closing at some point?
Well, you know, I think this is possible, you know, for various reasons. Because of the recommendation of like staying home as much as possible, you know, I'm afraid that what might happen is that there might be some economic, you know, consequences to some of our business owners. So that might be one reason. We know that some of the grocery stores are reducing their hours. You know, from what I know of what's going on in Europe, a lot of stores are closed their doors or have been asked to close their doors. So yeah, it's possible.
It's definitely going to be difficult for the community that, in general, it's outside of the norm for what we expect as our normal day-to-day routine. So you see stores that have no toilet paper, no hand sanitizer, foods limited because people are scared, panicking a little bit. Is there a reason to feel better than we do?
So in preparedness, we certainly are always advocating for, you know, hope for the best, prepare for the worst kind of a situation. It's still a little early on. We're certainly hopeful that a lot of the social distancing measures that we're advocating for will have the desired effect. Some of the concerns regarding supply are more about, you know, hey, what if, a certain percentage of truck drivers get sick or warehouse workers get sick and stuff like that. So those kind of things could slow down a supply line. So even if, we can't really target the likelihood that stores or grocery stores are going to close altogether for a little while, we certainly do want to be prepared for possibly a slowdown in shipments. There's really a wide variety of ways where our daily supply line that we're used to, that we've grown accustomed to, could be at least slowed down, if not interrupted for a little bit. So again, that's one of the reasons why we're going to be working on this survey. That's one of the reasons why we've asked people to kind of get some non-perishable food available, because those that do have some non-perishable food, that creates slack in our overall system of demand. And hopefully, we can certainly have individuals that are working together in the community to make sure that anybody that doesn't have will have an opportunity to be able to get help from their neighbors. So I wouldn't say that this is cause for frustration or depression or anything like that. We understand that this is can be a little bit of a scary situation, but we're doing everything we can to try to make sure that we're getting our heads together as a community to help anybody in need.
So Bella has sent a clarifying question for the hotel one. Thank you, Bella. She says, I was referring to hotel lobbies and breakfast areas where many people can gather. So we have hotels that will provide, or have in the past provided, your continental breakfast in the morning. What do we know anything about regulations regarding that?
Well, I think they are likely going to take measures because it's very clear in the order that I just need to find it. There is a clear conversation. So on page 2 of the order number 2007, it mentioned under point 2 that establishments may offer food or drink for off-premises consumption, so either takeout or drive-through or for delivery. So I'm gonna make an assumption here that that would also apply for possibly hotel lobbies, or that what they could do is make sure that their breakfast arrangement and situation ensures for the social distancing that is recommended in the order.
I would imagine
Because
they
they
could also
are
limit
not-
the number of people, right?
Exactly.
Sure.
Yeah, there's a lot of things that can be done. Yes.
So to piggyback on the social distancing aspect, I know as the PIO, I fielded a lot of calls about what it actually is and what it means, and because I think we use this word a lot, not just us in public health division here, but you see it a lot used in the media right now, explaining what it is, maintain social distancing, maintain social distancing. You don't truly understand what social distancing means. Could you explain it?
Sure. So any illness has a measurement that tries to describe how many individuals under normal circumstances could be infected by a single sick person. Okay. That measurement has a lot of different factors that go into it, without getting too deep in the weeds here. But one of those factors is how close we are to each other, how just even a small amount of transfer of pathogen can be enough to infect someone. There really is a variety of things, but like I said, the biggest issue in a lot of cases is how close we are with each other, how many different individuals will a single person come into contact with, and long enough to provide that opportunity for infection. So if under normal circumstances, say, if someone can possibly infect 3 to 4 people when we haven't taken any measures, if we then go to this method of social distancing where we're trying to keep distance from each other and we're trying to limit the amount of close contact interaction, we are not expecting to eliminate the spread of illness, but more just trying to slow down the spread to a point where it's not going to overwhelm the hospital, because if I'm a sick person and I come in contact with 10 people in a day and I make half of them sick, all right, and then you multiply that by the number of potential ill people in the population, those are all those people that I made sick could possibly in a very short amount of time need medical attention. But if I'm only coming in contact with 2 or 3 people and I only make one of them sick, then you can see that on a multiplicative scale, there's going to be far fewer people in a community that need to see the doctor at one time.
So is that's what they're referring to when they're talking about flattening the curve, right? Is because then it keeps that lower and maybe a little bit wider.
Yeah, I mean, it is likely going to extend the overall length of time we could be dealing with an illness in the community. However, because it's not a whole bunch of people at once, those hospital beds aren't going to get full. We aren't, increasing the chance that a doctor is going to become ill and then kind of have to leave the pool of those that are available to help others. It really is a multi-pronged impact if we can really just reduce that amount of social interaction.
So Savannah asks, if one of our children has a well child check, do you recommend canceling it, or should they go and still maintain that appointment?
That's a pretty good question. I would certainly leave that between you and the clinician. However, I do know that a lot of individuals in the medical community are starting to work on kind of making some adjustments in their practice, looking for opportunities to have telemedicine, but there are a lot of what somebody could say, hey, could this wait a couple months type appointments, and yeah, that would be worth it to, all other things being equal, that might be worth postponing an appointment like that for a couple months. But absolutely 100%, we are not here to give medical advice as far as that relationship between your doctor and you. We want you to make that contact yourselves.
So it's safe to say that if you have questions regarding an upcoming appointment, call the office and see what their recommendations are.
Absolutely.
So Savannah, I hope that helps. I think I have to do the same thing with my children now that you reminded me of it. I have another question. And now I can't remember what it was. Savannah got me off track. But it's okay, it was a good question. Damn it. We have 12 more minutes. So if there are any more questions regarding the COVID-19, how you feel about it, please let us know. Again, Angela's email is in the comment section a few times. We have some people tossing it around, so if you want to get involved in this fight, please contact her. Well, good. I'm glad it helped, Savannah. She said it did. Thank you very much. We've got some really great people on here today. Remember, we're going to be doing this every week. So if you come up with a question from the time we hang up tonight till the time we get back connected next Tuesday, please email the covid19.questions@chw.coos.or.us. That's on your screen. You can also send Coos Health and Wellness a message via Facebook if you've forgotten the email address. You can also visit our website, cooshealthandwellness.org, that has the email address link there, as well as sign up for our situational status that should come out every night, updated very eloquently by Florence and her team. So you'll be up to date on the most information. Brian, do you have something?
Yeah. So since there's been some questions about how much you can help public health tonight, just one thing I want to add. We really appreciate that concern. We are working really hard to try to do everything we can to protect the community. We understand that this illness has raised a lot of anxieties, but part of the questions that we are fielding on a regular basis from folks have to do with rumors about whether or not there have been positive patients in the county that we are just either we or a medical facility may be kind of keeping under wraps. And I can tell you, there are a lot of inquiries that we're trying to cover. We understand that those questions are going to come up sometimes. We understand how rumors work. But if you all, as champions of public health and advocates of public health, if your family members or friends start bringing up these rumors, if you can do what you can to say, the public health team would not keep this from us. We are honestly, you could even say that we would be motivated to tell the community about a positive test, because I think there are individuals out there that are saying, hey, we don't have a positive test. What's the worry? So we do absolutely want to share the most up-to-date information with you. And if you can tell your family and friends, those are just rumors, please listen to public health. We would really, really appreciate it.
I think that's a great point. It serves us no good to try to hide a case when we want to try to ensure the safety of the community. We would want people to understand that. And I think one thing I've had to do in the last few weeks as the PIO is monitor the social media and see what conversations are being had out there. And I think one thing that a good number of our community is doing, and I really hope that they continue to do so, is to try to squash a lot of those things. But understand that they do come up, and they are baseless unless otherwise substantiated by the public health department, which we would do promptly.
Absolutely. And just to add on to this, you may or may not know, but your public health department is a small public health department with a mighty team of tremendous people who have been working very, very, very long hours, and who for some positions do not have a backup at this point. So if we could, try to limit the amount of, and I'm not saying not to call us with questions, this is not what I'm saying. But like, for example, today we had to spend staff time debunking a rumor about 14 sailors being quarantined in Northland Medical Center. And so that means like I have my liaison person having to call the port and this and that to make sure, that to make sure that we confirm or debunk that thing. But that takes him away from trying to figure out how he gets personal protective equipment for a healthcare provider. So this was the reality today. And then Eric has to be taken off some other duties. And I'm just saying this to really make sure people understand that we are a small team of folks, and we have been trying to be very proactive and efficient in the way we are handling this situation so that we are as prepared as possible. And yes, please debunk those rumors. We have no intention to keep anything from anyone at this point. I think we've been pretty transparent and candid in our communication with the community. Trust that we are not keeping information away from anybody.
Well, and these forums weekly, until further notice, are a way to engage with the community in a safe and effective manner, and give you as the community the opportunity to ask us questions. Oh, Sterling had a question. Can people in Coos County that have no health insurance get tested?
I would say the ability to pay at this stage is dwarfed by, again, the supply of specimen kits and other materials that are needed to perform those tests. The ability to pay would absolutely be something that would be focused on once the supply and demand issue is resolved, but that is already something that we're working with in terms of the insurance companies in Oregon, our own medical community here locally. We want to make sure that that is not a barrier once it gets to that point.
All right. We have 5 minutes left. Is there anything that, Brian, you kind of have a nice statement, made me teary. Is there anything else that you guys would like to stress to the community while we haven't engaged at this point?
Well, what I just want to say is I think we're pretty resilient and tremendous community. And, you know, our experience with the entire system at this point has been amazing. I think people are really coming together and coordinating and collaborating, and this is amazing. So I just want to say thank you to everybody. Thank you for being on that town hall. Thank you for your questions. If you have even other suggestions or things, you know, like we have a few brains available still, but you know, it's good to like the question that we received from Mark, I believe, earlier on. You know, like we didn't think about taking to grocery stores.
Yeah.
So don't hesitate to contact us. Probably the email is the best way at this point, just because fielding calls takes a little bit longer and we're not always available.
And again, that's the email that's on your screen right there, the COVID-19.questions. Also, once we're adjourned here, you can get it on our website. There's a link there. It does take the community, right? I mean, we can brainstorm all day, every day for the last 3 weeks about what we need to do next in our community. But sometimes it takes someone pointing out something that may seem obvious, but we just haven't worked into there. Sterling, I don't know if you were on a little bit ago, but we answered the question about the drive-throughs. Our environmental health crew is working diligently to ensure the safety and sanitation practices of all of those. And we have no reason at this point to believe that they're doing anything otherwise. And we would really recommend that you try to help utilize those establishments so that they aren't impacted as economically as they could be otherwise. I have your email in the email form. If that doesn't answer your question, please email us again, and then I will get someone to send you that email response. Okay, I think we're gonna wrap it up here. Thank you everybody for joining us tonight. We look forward to having you join us again next Tuesday. This will be an every Tuesday event until we have no reason to have these events. So we could be getting together every Tuesday for a while, like a family, a good engaged community. And hopefully if you have any questions throughout the week, please don't hesitate to email us at the COVID-19.questions, or you can send us a message on our Coos Health and Wellness Facebook. And always, while we're doing the live feed, you're welcome to send those questions in the comment section. So for Coos Health and Wellness Public Health Division, I'm Eric Gleason. Thank you, Florence. Thank you, Brian. And we will see you next week. Have a good night.